Pressure applied directly to a bleeding site until bleeding stops is the standard method for controlling external bleeding. It is simple to do, requires few materials, and it works well most of the time. The use of pressure points or elevation of a bleeding limb are no longer recommended bleeding control measures. Bleeding can expose you, the provider, to potentially infectious body fluids. Use disposable gloves as a barrier to protect both you and the injured person. Wear protective eyewear to protect against splashing or spraying blood. Keep in mind that serious bleeding occurs when a large vessel is damaged. The focus of direct pressure should be on the bleeding vessel within the wound. Quickly expose and inspect the wound to try to identify a point of bleeding before applying pressure. Using a clean, absorbent pad or dressing, apply firm pressure with your fingers or palm directly on the bleeding site. Controlling heavy bleeding requires firm pressure. Push hard when needed, even if it is painful to the injured person. If a pad is not available, apply direct pressure with any fabric, cloth, or just a gloved hand alone. To maintain any clotting that occurs, leave the initial pad in place. If blood soaks through it, apply another pad on top and continue to apply pressure. Replace the second pad if it soaks through. Too much padding can reduce the effectiveness of direct pressure. Once you have applied pressure and controlled bleeding, it is essential to maintain the pressure until more advanced care is available.